Well, it's great to be back, Bev, and thank you for having me. It's a sad state of current affairs that we are dealing with something even more tragic than the global pandemic. But one of the areas I covered for WHO for many years was ensuring access to safe and essential services in emergencies and not. And this is one of the fundamental rights guaranteed by the Geneva Conventions. And for your listeners' short history lesson, those were drawn up after World War II to ensure that atrocities that happened during that terrible time never happened again. So this, and protecting healthcare personnel and protecting healthcare sites was one of the things that the international community all agreed should never happen in terms of these attacks.
Yeah. So let's look at this current conflict between Israel and Gaza. We've seen hospitals targeted by Israel and come under enormous pressure. Israel has argued, of course, that these hospitals were being used by Hamas and some of the staff were actually helping Hamas. What is your sense of how hospitals have been weaponized in this particular conflict?
Well, this aspect of the weaponization of healthcare is a very problematic one. The recent work that we did, my colleagues and I did, on attacks on healthcare was to talk about three things, really. First, to call out the attacks on healthcare and some of the rationales behind it, so if I'll come to that. Second was to put it in context. It's not new, and we need to not stop treating it as something new. And third was to talk about some of the innovation and investment that's needed to make healthcare more resilient. So on this weaponization of healthcare facilities, there's been a lot of accusations made particularly in Gaza, but also in Ukraine and Sudan about enemy combatants using healthcare for sites to hide. Many of those claims have been debunked, but the international law is clear on this, that there cannot be a presumptive invasion of those healthcare facilities and presumptive killing of suspected combatants without warning and without proof, which in many cases has not been done. And the attacks have to be targeted towards those combatants. So blowing up an entire level of a hospital doesn't really qualify as that.
Yeah. And to your point about effectively ensuring that these systems remain functional, it becomes very complicated when it's very difficult, say, for example, in this case, to sort of intervene for any sort of neutral body to control the healthcare services in a conflict like this.
It's very true. And I think this is why, in the case of Gaza, you have an invading, occupying force. It is the responsibility of that force to ensure that healthcare is delivered. So I think it's also important for listeners to realize that healthcare is not just the sort of emergency rooms and the trauma surgeons fixing people who've been wounded by attacks, which does happen. But it's also the supplies that have to reach there. Someone who directed WHO's work for years on this, you cannot operate a hospital without fuel. It doesn't work. You can't perform surgery, or performing surgery without anesthesia and oxygen is inhumane. So you've got a lot of that going on. So it's at many levels. It's the attacks on the facilities themselves, the harassment of patients that come to those facilities, but then also supply chains being denied. And that's not unique to Gaza. It's particularly spiking and very problematic in Gaza right now.
Yeah, and you know, the WHO has pointed out just the volume of attacks on Ukraine healthcare services and infrastructure has just been enormous. How has this exacerbated the conflict, and also to a degree given, say, for example, Russia in this case, the upper hand in many cases?
Yeah, I think that's a great point, Bev, because we need to look at this in context. There's a huge spike. WHO reported last year that the biggest number of attacks on healthcare ever in a conflict was happening in Ukraine. Since the start of this year, you've got WHO has a dashboard that tracks these officially. The attacks on healthcare, you've got over nearly 250. 3/4 of them are in Gaza. The rest of them, almost all of them, are in Ukraine. So clearly Gaza's on track to surpass that number set by Ukraine. But it's also not new. In 2020, there was a large circulation of a petition by 22 civil society organizations asking international organizations and leaders to focus on attacks on healthcare. And when I was at WHO in 2014-15, there was an organization of a monument to the over 1,000 healthcare workers killed during those years at the World Health Assembly. So it's not something new. It's being increasingly seen as something that just happens as a result of war, and we have to stop thinking of it that way.
And you know, you make a really good point, because it's not just even the people of the country that are targeted, but so often in a humanitarian sense and in, you know, trying to deliver these kind of medical services in conflicts, people who are trying to assist get targeted quite deliberately.
That's exactly right. And you can see some of my colleagues working at the Palestinian Red Crescent, for instance, in Gaza, going out, being called out with their ambulances to go retrieve injured individuals. One just a few days ago that captured international attention, retrieving a young wounded girl. They were not able to reach her because of attacks, and they themselves were bombed in their ambulance. So there's the allied health personnel that are delivering these care in very difficult circumstances. And I think it's one of the areas that we need to start thinking about: how can we plan for the fact that in conflict, healthcare is going to need to be provided by personnel with less training than they need to have in circumstances that are very difficult, and coming up with innovations that address that is going to be really important.
Yeah, that's something, I guess, that often gets discussed after this. Do you feel that healthcare workers have been able to speak up enough, and should they be allowed to in these types of situations?
I think that healthcare workers have a duty to speak up when this type of action is being taken that is so clearly against international humanitarian law. And that is the principle of a free society, that actors who are involved in delivering these care should be able to speak up and talk about. And this is not just people in Gaza who have the benefit of firsthand knowledge and eyewitness accounts, but also health professionals, medical societies, the World Health Organization. My former leadership there has been very strong in speaking out against these attacks, but other medical associations in the US and Europe and other places have not been speaking out against it. And it's really something that's core to the first do no harm mantra of medical delivery today.
It's really great to get your expertise and just your experience in these matters. Nice to see you again. Thanks for your time.
Thanks, Bev.